It's 105.5 WDHA here on the Jersey Magazine. As we get into the beginning of the baseball season, we've got youth baseball, high school baseball, college baseball has actually been underway for a little while, and we've just gotten opening day of the Major League season underway. Dr. Carmen Romano is my guest. Carmen, good morning and welcome to the Jersey Magazine.
Good morning, and thanks for having me. I appreciate getting on and being able to do some, educational stuff.
So I do want to talk to you about that because you and I have had the opportunity to work together a little bit over the past couple of years through Madison Medical and Sports Rehabilitation in Madison. What are some of the more common injuries that you're seeing at this time of year in the spring and the beginning of the sports spring seasons, Carmen?
Believe it or not, compared to 5 to 10 years ago, I think a lot of kids are now, kind of going into the season with things that we used to end the season with, like the elbow and shoulder type injuries that, stats are showing the elbow and shoulder injuries are up like about 500% in the last 5 or 6 years. So I'd say they're the most common. The hammies, obviously are big, and they've always been big due to the fact that the East Coast weather is not exactly forgiving for baseball and that explosive movement coming out of the dugout.
Yeah, absolutely. What do you think is a reason, what accounts for such an increase, especially in arm injuries?
Honestly, I'm going to say there are 3 things, one of which we can't control. So I think 1/3, the size of our athletes have changed. And obviously with physics, when you have more of a lever or leverage, you can produce a ton more torque and force. So those are one of the things, obviously, that we're happy about and that we know we're not going to be able to change. The second thing I'd say would be the single sport athlete and a lot more of the winter training that's going into, let's say, baseball or softball. And I'd say mainly the overuse and combined with some of the strength and conditioning that isn't necessarily dedicated to, let's say, a pitcher or a catcher or a left side of the field baseball player. And then the third thing, if we don't want to change the second thing, which I think the second thing would be very difficult to change, kids that are, as they hit 14 and 15, really concentrating on one sport because it is so competitive, would be the lack of recovery mechanisms that have been set into place for these athletes. So they're going to work their buns off all week, whether it be strength, conditioning, throwing, and, obviously a bunch of other things they can do. But I don't think enough athletes have the professional type regimen for forced recovery. And that's not rest. Those are modalities that actually decrease your healing time from a bullpen, let's say, or from throwing 5 or 6 innings, or from working out, so that your chances of being close to 100% the next day for whatever workout you choose are greater. And that seems to be what I'm, anytime I have an athlete coming in with we call it an overuse type injury, I always kind of look at the parents and they say, well, I think he's pitching too much. And I say, well, I have other 16-year-olds in here that pitch exactly the same amount. Number one, we're looking at their biomechanics and seeing if something's wrong or off. And number two, what's their recovery rest mechanism, their sleep habits, their diet, and their forced recovery. And it all, if we're going to compete at this level, you kind of have to dedicate yourself to making sure your body's at 100%. And I don't see it happening.
I'm glad you mentioned rest and nutrition, because I think that's a hugely overlooked part of this whole thing. When you're young, I'll just burn through it. Even though I'm a little bit tired, and the nutrition, obviously, and I think that's of any age. We all eat a lot of nonsense, but I don't think you can stress the importance of getting rest. And I'm seeing it at the high school level, coaching at Jonathan Dayton in Springfield this year. We're constantly telling these kids, freshmen all the way through seniors, you got to get your rest on a regular basis. You can't try to burn yourself out.
Yeah, I agree. I'm not sure where I would weigh on the scale rest to nutrition to the forced recovery type of modalities, maybe 33 1/3 for each. I try to really implore my athletes to wake up early at the same time to create some of that discipline and decrease of anxiety in the morning with the potential of a stretching regimen. But in order to do that, these phones and staying up till 11, 12, 1 o'clock in the morning, it's definitely catching up to them come a Wednesday game or a Saturday game. And then, of course, your body isn't recovering, and it catches up to everyone with the injury.
You've used the term forced recovery a couple of times in our interview this morning, Dr. Romano. Tell our listeners exactly what that means.
So, I think it's an overused word, active recovery. Active recovery tends to be something like getting on a bike, doing some stretching, going for a walk, all forms of, I guess, creating some mobility and getting rid of some of that lactic acid and keeping the muscles a little bit looser. Forced recovery would be in the line of compression sleeves, making sure that, getting good blood flow and decreasing that healing time, getting stretched out, getting adjusted to stay mobile. Cryotherapy is a big one. I always say this, I did a lot of research over the last 10 years and started paying a lot of attention to the professional ball players, whether it be NFL, NBA, NHL, and Treat, by the way, and MLB. And there's something to be paying attention to. I mean, it's their career to keep their bodies healthy. So why not watch a little bit and see how they're doing it? And I know a lot of these high school and college athletes feel most of these things are for the pros. But at the end of the day, if you break down, let's say, one of your Jonathan Dayton baseball players, and you break down the amount of hours they're spending and miles they're putting on their body throughout the week, I don't think you're going to see much of a difference than you do a professional athlete. So there's the other issue. We have some growing boys and girls that are putting in pretty much the same amount of time as a professional athlete, but doesn't have either the knowledge or know where to go and get the professional locker room. And, you talk about a pro locker room. When you walk in there, there's someone stretching them. There's someone doing manual therapy. There's cryo. There's a chiropractor. There's someone talking nutrition. There's someone cooking for them. So how the heck is someone supposed to, get their hands on all this stuff? And when do they find the time? If you're serious, you make it. You make the time.
We're speaking with Dr. Carmen Romano from the Madison Medical and Sports Rehabilitation in Madison this morning here on the Jersey Magazine. And we've been talking about young athletes this morning. And one of the things that I impress upon kids, and I've coached middle school before, and obviously now at the high school level, is especially 7th, 8th, 9th, and even to some extent 10th graders, your body is going to change. Like, you will not, I'll tell 8th graders all the time, you won't recognize yourself in 2 years. A freshman, same thing. You're not going to recognize yourself in 2 years. So if in fact these kids are putting in a comparable workload to what a college or professional player would do, that's an awful lot of strain on a body that's still changing, Dr. Romano.
Agreed. It's also a lot of stress on the growth plates. You hit at 15, 16. Yeah, I think you hit it right on the head for boys. For girls, not so much. They tend to obviously mature a little bit sooner physiologically in their bodies. So their growth plates tend to be, pretty much well formed by the time they're 16. But yeah, you're right. I mean, between 8th grade and senior year, that's boys to men, and there's a lot of growth changes, muscular changes, physiological changes that and imbalances that, if not dealt with. And I always say this to patients, it doesn't matter what age. I have patients that are, 55, 60 years old. I'm getting old. So now I have 17-year-olds in here with this stuff. And it's because of the amount of miles they're putting on, the imbalances. And that needs to be looked at and addressed. Getting assessed for symmetry of muscle, joint motion, and your nutrition can mean the world. And I say, I always ask this question to, boys and girl athletes that really want to get to that top level. I ask them if they can give me the 3 things of what it takes to make it. So everyone kind of looks around at each other and there's always hands go up and someone says, so go ahead. And they say, you have to have talent. It's okay, good. You got one. You have to have the genetic talent and ability to be able to make it. Okay, two. Then you get someone's hand up and, they tend to get the first two right. Second one would be the work ethic, right? You got to put the time in. You got to put the work in. I said, okay, give me three. What's number three? And third thing would be staying away from injury. And that's a big problem. That's a big, big problem. So let's say you have the talent, you have the work ethic, you're putting it in, and we grew up grinding and working through things, and it's all a good mindset. But if injury sets in, to put you out for weeks, months, and potentially even your career. So that third thing is about as big as it gets.
You and I were speaking, Dr. Romano, before we came on the air this morning, and I deal a lot with arm injuries, but I said to you that I've really noticed in the past 2, maybe 3 years, the number of ACL injuries that I'm seeing in young athletes, especially that 9th, 10th, 11th grade level. What do you think is accounting for that?
So I have three things with this one too. It seems to be a numbers game of three. Size, again, plays a big role. I think these kids are getting bigger quicker. So again, you have more of a fulcrum there for impact, right? The weight obviously plays a role while they're growing. The amount of miles that they're putting on their bodies. Again, injuries that we used to see more at the latter end of college or pro level, you're seeing them all creep into the high school. And I think it's because of these miles that a lot of the single sport athletes are putting on their body. And then again, the recovery mechanism, they're not spending the time or don't have the knowledge to spend the time getting stretched, checking out for asymmetries, nutrition. So it's kind of the same injury path, I would say, to the shoulder and elbow. Just really depends on the position.
With the spring sports seasons getting underway, we're speaking with Dr. Carmen Romano this morning from Madison Medical and Sports Rehabilitation in Madison here on the Jersey Magazine. One of the things I hear a lot from young kids, pitchers especially, is how do I throw harder? You'll hear it occasionally from a catcher or an outfielder or infielder, but the pitchers are chasing velocity. And Carmen, I find them chasing velo at younger and younger ages. And it concerns me because I think we're getting away from the idea of teaching a kid how to pitch, and we're just teaching them how to throw hard. And, kids can get drafted throwing 90s. There's no two ways about it. And I think a lot of college programs look at it and go, well, he's throwing 93. We'll clean up the mechanics later. We'll worry about everything else later on. How much of chasing velocity is the number of injuries based on, do you think?
I think it's big. I think for pitchers and catchers, remember the time, their big recruitment issue for catchers happens to be that time when they get the ball to the time they get that ball down to second base and their exit velo. So I agree with you 100%. I think let's face it, if you're in position genetically to throw over 90, it's no different than a 14-year-old coming to me saying, hey, doc, or dad saying, hey, I want my 14-year-old to get bigger and get to the gym. And your body needs to be ready for these things. You can't force that exit velo. You have to get with the right mechanical coach, get those things down first, and the 90 plus will come if it's in your cards. It's like teaching speed and agility. Can you get someone a little bit quicker? Absolutely. But if you're not teaching the proper mechanics to running and to take off, number one, you're not going to get as fast as you like to, but number two, you're going to get hurt.
One of the phrases that we've heard over the past couple of weeks now, courtesy of Jacob deGrom, is stress reaction. And I know a lot of Mets fans are all, oh. What's the difference between a stress reaction and a stress fracture, Dr. Romano?
I think they're catching it a little bit sooner. I think rather than the athlete pushing through the common areas of a stress fracture, which generally speaking, shin, there have been some stress fractures of the we'll call it the thoracic or lumbar spine vertebrae. That seems to be more in the adolescent athlete that grows really quick. and in the growth plate by the knee. Also, I think you can get a stress reaction from, from getting hit by something, slid into or hit by a ball. Usually they call that a contusion, but generally speaking, a stress reaction lights up on a specific type of diagnostic, and they'll just see some sort of blood reaction to an injury. No tear, no fracture, but there's an aggravated area of inflammation. And it's super painful. So I imagine, I think they had said he'd be out for 4 weeks.
Yeah, they're going to shut him down for at least a month, and then they obviously have to build his arm strength back up. So I'm figuring probably mid-June before we see him.
Well, so let's see. So I'm glad we talked about this. I think they're going to overestimate just in case, but I think he'll be back sooner than that with the type of modalities they're going to be using. Recheck of his mechanics. Again, that's a big factor in a lot of these overuse injuries, whether it be a stress reaction, a sprain strain, a sore shoulder. Mechanically, if he wasn't injured and it wasn't any type of a impact injury, like a sprained ankle would be considered an injury, right? Nothing you could potentially present. You slid wrong into the bag, you sprained your ankle. This injury was from use. So what I think they're probably gonna do is break down, once he starts to get a little bit healthier, his mechanics, video him, slow it down a little bit, and then you'll pinpoint exactly, because they have the answer to the math problem. Any pro or junior athlete that comes to me with an injury, I have the answer to the math problem, whether it be knee, right side, low back, left side, or shoulder, and where in their shoulder, and when in their pitch mechanics it hurts. I already have the answer to the math problem. It's pain here. Now what I have to do is figure out the back end formula of how it got there if it wasn't any type of an impact injury, if that makes sense.
Yes, absolutely.
So similar to a right ACL tear of a quarterback just heading down the field. If you ever seen these injuries, it looks like they've been sniped. It's not due to a hit, which is what we were used to back in high school and colleges. Generally speaking, these ACL tears or these stress injuries, whether it be fracture or reaction, was due to a hit. These are happening out of nowhere. What I like to see happen is if a torn ACL or a stress reaction of the shoulder was non-traumatic, then mechanics really need to be looked at, or what you're going to be faced with is upcoming issues. If all we're doing is healing the stress reaction and giving him rest, or if we're just doing, let's say, ACL rehab after surgery, you're in line to either tear the other ACL or re-injure the existing one, because no one changed how you got there in the first place.
Well, I know Met fans are going to be holding their breath until they see Jacob deGrom back on the mound, and hopefully that is sooner rather than later. Dr. Romano, for DHA listeners, especially parents who want to find out more about how they can take care of their son and daughter and get them through the springs and into the summer and fall sports seasons, where's the best place for them to go to reach you?
I'd say for now it'd be the website, MadisonMedicalNewJersey.com. I keep it real simple. There's a quick drop down landing page that they could put their information in and kind of pick a subject that they want to get called back on and brought in to get looked at. There's not a lot of bells and whistles to the website, but I've noticed it seems that like batting, the more quiet and simple, the better.
Again, MadisonMedicalNewJersey.com. Dr. Carmen Romano, thanks for your time. Let's do this on a regular basis on the Jersey Magazine. We got a lot of good topics to cover.
I would love it. Thank you so much.